Hi everybody. So today we're going to be talking about the arteries of the femur and the knee, so of the femur region. So if you recall in the last video that we were talking about, we said that you had the abdominal aorta. Okay, and then what's going to happen is the abdominal aorta, when it gets to about the fourth lumbar, what it's going to do is it's going to bifurcate. And what it's going to do is it's going to become the common iliac artery. Now, I'm going to have one over here, right? But I'm going to go into that in just a minute. So here's my common iliac artery. And then we said what's going to happen is this is going to continue down, and then we're going to get a branch off of this, and this is going to become the external iliac, which I'm going to be talking about in a few minutes. But then we get the internal iliac artery. Okay, and now what's going to happen is coming off this internal iliac artery, I am going to have the superior gluteal artery, and then it's going to continue down, and then what's going to happen is I'm going to have the obturator artery, so it's going to be there, and then I'm going to have my inferior gluteal artery, and then what's going to happen, this is going to continue down and become the internal pudendal artery, and this is going to go out to the external genitalia. Okay, so that's the internal iliac. Now, there's other branches on there, but I was just doing a quick overview. So now, let's go ahead and take a look at the external iliac, and I'm going to move the camera, and we're going to look at this on the other side. What's going to happen? Okay, and this is going to take up a lot of room here. So I have my common iliac artery, which is going to be right there, right? This is going to be my right common iliac, right there. So now, what's going to happen is my common iliac, like we said, is going to turn into my external iliac artery and my internal. So I'm just going to draw the internal all the way over here because we're not going to be talking too much about it. But this is also going to be my internal iliac right there. So now what's going to happen? This is going to continue out, and then it's going to get to the level of the inguinal ligament. So here's my inguinal ligament. And when it gets to the inguinal ligament, what's going to happen is this is going to become my femoral artery now. So this is going to be my femoral artery. Right there. So this is the femoral. Okay, and then this is going to continue to come down. But now, coming off the femoral, I am going to have another artery that's going to be called the deep femoral artery. So this is going to be my deep femoral artery. Okay, and then coming off the deep femoral artery, I'm going to have some more arteries coming off of here. So what's going to happen is I am going to have something that we're going to call the lateral femoral circumflex artery. And that's going to be this guy that's right here. Now, this lateral femoral circumflex artery is going to have three branches. I'm going to have the ascending, lateral femoral circumflex artery. Okay, so I'm going to have the ascending branch. And this is basically going to go back towards the femoral, back to about the neck and the head of the femur, and it's going to supply some blood. Then we're going to have the transverse lateral femoral circumflex artery. And this is going to come lateral, but it's also going to go back and it's going to form an anastomus with some other arteries too, but that's going to be the transverse lateral femoral circumflex artery. Coming off of here also, we're going to have another branch, which we are going to call the descending lateral femoral circumflex artery, okay? And just so you know, some books actually changed this and they actually called this the circumflex femoral artery. But anyways, so let's go back over to this deep femoral artery now. And here it comes. It's coming down like this. And then what's going to happen is it's going to have some little branches that come off of here. There's going to be 3, and these are going to be called perforating arteries. And the reason they're called that is because they're going to go and they are going to perforate the adductor magnus. And then this is going to continue down and it's going to go to the popliteal artery. So we'll come back to that in just a minute. Let's go back over here to this femoral artery now. And this is going to come down. And then when it's about 12 to 17 centimeters above the knee, we're going to have something called the descending genicular artery, okay? And this is going to come out and it's going to basically come off into 2 different branches. And this branch here is going to be called the saphenous artery. So this is going to be my saphenous artery right there. And then over here, we're going to call this the musculo-articular artery. Is going to be this branch right here. Okay, so we got those right there. Now we're at the knee. Okay, so we have these 4 things right now, and we're at the level of the knee. So here's what's going to happen. Right about here, there's going to be something we're going to call a hiatus. So let's call this the hiatus of the adductor magnus. Okay, that's the hiatus of the adductor magnus right there. And after we cross that hiatus of the adductor magnus, this is going to become my popliteal artery. That's going to become the popliteal artery. So let's talk about something real quick. We had this deep femoral artery right here, right? There's my deep femoral artery right there. We had these 3 perforating arteries here, right? Now what's going to happen is this is going to continue down and it's going to join this popliteal artery that's right here. Okay, so that's going to join the popliteal artery that's right here. Okay, so here's what's going to happen now off the popliteal artery. There's a few different things. One of them is going to be, I am going to have an artery that comes off of here. I'm going to start using different colors just to keep this clarified. And we're going to call this the middle genicular. Okay, so this is going to be my middle genicular. Remember, genicular means knee. So we're at the knee right now. This is my middle genicular artery. And this is going to supply blood to your anterior cruciate ligament, your posterior cruciate ligament, and some of the synovial membranes, but mainly the anterior cruciate and the posterior cruciate ligaments. And if you recall, these are going to be responsible for holding your knee in place, right? They're going to be inside the knee. So this is coming off the back, going between the condyles, and then into the knee to supply blood to those 2 ligaments. Now, coming off of here, also, we are going to have, I'm going to use the color blue, even though I normally use blue for arteries. I'm going to use it right now just to show these. These are going to be coming out right above the condyles of the femur. And I'm going to have my superior genicular artery. I'm sorry, this is going to be my medial superior genicular artery. So as you can see, this is the medial superior genicular artery. and it's going to go out and form an anastomosis with the musculoarticular artery. Now, if I have a medial superior genicular artery, that means I must have a lateral superior genicular artery, which we are going to come out this way, and it's going to come out here to this descending lateral femoral circumflex artery. So we're going to form an anastomus right here, and it's going to be right alongside the knee. All right, and this is going to be my lateral superior genicular artery is right there. Okay, so that's going to be where this ends. Okay, so we're going to go like this again, and okay, so my descending lateral femoral circumflex artery is going to form an anastomosis with the lateral superior genicular artery. Okay, one other thing now, coming off this musculoarticular artery, I am also going to have this guy that's going to come all the way over here, and it's also going to form an anastomosis with this lateral superior genicular artery also. So now, if I have a medial superior genicular artery, that means I must also have an inferior genicular artery on the medial and lateral side. So I'm going to use green for this. And remember, now we're going below the knee. So this is going to be basically at the top of the tibia right here, right? Just below the tibial plateaus. These are coming out right above the condyles. This is coming out right below the tibial plateaus. And this is going to be my medial inferior genicular artery is going to be right there. This is going to come out and it's going to form an anastomosis with the saphenous artery. And again, this is going to be right on the side of the knee now, right? So now there's my medial inferior genicular artery, but here's the other thing that's going to happen is this medial superior genicular artery is also going to form an anastomosis with this medial inferior genicular artery. Boy, oh boy, is that a lot of words. We're getting there though, we're getting there. So here's what's going to happen next, is we have the medial inferior genicular artery, so that means I must have a lateral inferior genicular artery. Oh, and look at this. This is going to be easy right here, easy peasy, because what's going to happen is my lateral superior genicular artery is also going to form an anastomosis with this lateral inferior genicular artery. So this is my lateral inferior genicular artery that you see coming right down here. Okay? And then, like you see, they form an anastomosis. So these are coming above the condyles. This is going to be right above, below the tibial plateaus, right? So you can see then my superior genicular arteries, both of them, my superior genicular arteries, form an anastomosis with my inferior genicular arteries, okay? So now we're at the knee. Let's go below the knee. So now I'm back to my artery. This is going to be my popliteal artery is going to be right here. And then my popliteal artery is going to pass this popliteal muscle. And then it's going to bifurcate, which I am going to do on another video. But now it's going to bifurcate into my anterior and posterior tibia arteries. All right, so that's basically the arteries for the femoral region. That's right there. So thank you so much for watching. If you enjoyed the video, please hit the like and subscribe button. That is a lot. But anyways, please hit the like and subscribe button, and I will talk to you next time when we start right here. I'm going to leave this up for a minute.